Today, we're going to unpack a health crisis that's kind of hiding in plain sight. It affects hundreds of millions of people, and its impact is growing way faster than almost any other major disease out there. We're talking about diabetes, and trust me, the story its numbers tell is, well, it's staggering. So let's just start with one number to really wrap our heads around the scale of this. 830 million. That's how many people were living with diabetes around the world in 2022. To put that into perspective, that is more than double the entire population of the United States. It's a massive, massive figure. But what's even more shocking is just how quickly we got to this point. I mean, just look at the speed of this. Back in 1990, the number was around 200 million. By 2022, it had more than quadrupled. This isn't some slow creep, you know? It's an absolute explosion. And the data shows this surge has been most dramatic in low and middle income countries, which really reveals a serious inequality in global health. And this statistic, this one shows a really critical gap in care. In 2022, more than half of all adults with diabetes were not taking medication for it. That means millions upon millions of people are facing this disease without the treatment they need. So it's not just about the number of cases, it's about a huge lack of access to care.
Okay, so what is actually happening inside the body? To understand that, we've got to look at the biology. You can almost think of it as a problem with the body's sugar switch. At its core, the definition is pretty straightforward. Diabetes is a chronic disease where one of two things is happening. Either the pancreas just doesn't make enough insulin, or the body can't properly use the insulin it does make. Either way, the result is the same: high levels of glucose or sugar in the blood. So what does insulin even do?
Well, insulin is the hormone that manages our blood sugar. And honestly, the best way to think about it is like a key. It's supposed to unlock our body's cells, allowing the sugar from our food to get inside and be used for energy. But without that key, or if the lock on the cell is broken, all that sugar just gets stuck in the bloodstream. And that's where all the problems begin. Now, you've probably heard of type 1 and type 2 diabetes, and it's really important to know the difference. With type 1, the body simply doesn't produce enough insulin. It's like the key factory is shut down. We still don't know the cause. But with type 2, the body is making insulin, but the cells have become resistant to it, so the locks on the cells are all jammed up. This is the type that's often linked to lifestyle and is thankfully often preventable. And this breakdown, it's really striking. Over 95% of all diabetes cases in the world are type 2. That is an overwhelming majority. And that's exactly why the rest of this explainer, and honestly most public health efforts, are going to focus on this specific type. So we've got the science down, but what does this all mean for people's health? Let's take a look at the real-world warning signs and the very serious dangers of uncontrolled diabetes. You see, the body does try to send out signals. These are the classic early symptoms: feeling super thirsty, having to pee a lot, blurry vision, feeling tired all the time, and losing weight without trying to. But here's the catch with type 2. These symptoms can be really mild and develop over many, many years, which makes them so easy to just ignore or chalk up to something else. And that right there leads to a huge problem. Because those early signs are so subtle, a person might not get diagnosed for years, and often it's not until serious complications have already started to set in. This is exactly why awareness is so important.
And the complications are severe. Over time, all that extra sugar in the blood from uncontrolled diabetes damages the body's systems, especially our nerves and blood vessels. This dramatically increases the risk of things like heart attacks, stroke, kidney failure, even blindness from damaged vessels in the eyes, and lower limb amputation because of nerve damage and poor blood flow.
And the consequences? They can be fatal. In 2021 alone, diabetes and related kidney disease caused over 2 million deaths. It's a quiet killer for sure, but a very real one. Okay, now here's where things get really strange. In an era of incredible medical breakthroughs, the death rate from diabetes has actually been climbing since the year 2000. That's deeply concerning, but it's only one half of a fascinating paradox. Because at the same time, the overall death rate from the 4 main non-communicable diseases, we're talking heart disease, cancer, and so on, has actually decreased by 20%. So the takeaway is pretty clear. While we seem to be winning the fight against other major chronic illnesses, we are actively losing ground against diabetes. But listen, this is not a story without hope. Far from it.
This is where we pivot from the problem to the solutions, because there is so much we can do, both as individuals and as a global community.
And this right here is the most crucial message of hope. For the vast majority of cases, type 2 diabetes is not inevitable. It can often be prevented, or at the very least significantly delayed, through proactive lifestyle changes. This is where the power really shifts back to us.
So what are the steps? Well, the World Health Organization lays out a super clear, actionable plan. First, get to and maintain a healthy body weight. Second, get at least 150 minutes of moderate physical activity every week. Third, eat a healthy diet that limits sugar and saturated fats. And finally, avoid tobacco. These aren't secrets, right? They are proven, powerful tools for prevention.
And for those who are diagnosed, the key word is management. With regular checkups, a healthy lifestyle, and the right medications, the condition can absolutely be controlled to avoid those severe complications we talked about earlier. So we have individual solutions. But with the stakes this high, what's being done on a global scale? Let's take a quick look at the path forward. This isn't just an individual battle, it's a global one. Health organizations are fighting back. The WHO, for example, has launched the Global Diabetes Compact, an initiative aimed squarely at improving prevention and care, especially in the countries that have been hit the hardest by this crisis. And that really brings it all back to us, doesn't it? We've seen the global scale, we understand the science behind it, and we know the simple steps for prevention. So the final question is a personal one. Knowing all this, what's one small change you can make starting today for a healthier future? Thanks for joining me.